Hi everyone! Ito na naman po uli si Richard Solomon of my YouTube channel Cha and My Narratives. Today, ito po ay tuloy-tuloy na mga video or vlogs na ginagawa ko po sa araw-araw in continuation of my own little campaign against COVID, no? Not necessarily ako po yung lalaban sa COVID, but through information dissemination, just like these vlogs of mine na makarating sa mas maraming tao, hindi lang po sa karaniwan tao, para rin po sa karagdagang kaalaman ng mga doktor, no? So sa mga doktor po dyan, please comment below if you're doctors, if you want to suggest additional or meron kayong gusto i-suggest na may vlog ko po dito, or makahanap po ako ng mga videos also coming from scientific doctors like Dr. Mike Hansen and Dr. Roger Schultz at sa iba pa na maaring kinakailangan nyo pong malaman ng mga karagdagang impormasyon, dahil as we all know, hindi naman po lahat ng bagay ay nababasa natin sa mga magazines or medical journals. Maaring, lalo especially now that the new mainstream media is now YouTube or Facebook at social media, no? So by way of YouTube and by way of my channel ay makarating po ito sa inyo ng mga clinical abstracts or medical abstracts na maaaring hindi pa po nakakarating sa inyo. And I've chosen at least 2 medical doctors or practitioners for now who are also doing vlogging, na nakikita ko pong napakasigasig nilang makadiscover ng mga research, may vlog ito, and also through their own research and studies, nagva-vlog at binavlog nila para may share po sa mas nakarami sa buong mundo, no? So again, hindi lang po ito, ang mga vlog ko po ngayon ay hindi lang po para sa mga karaniwang taong katulad ko. I'm not a doctor, by the way, but through vlogging, namimili po ako. It is our way as a vlogger na mamili po kami ng mga content na maaring makakatulong po sa mas nakakaraming tao. At kasama na po rito ay ang mga doktor na katulad nyo. So please comment below if you're a doctor, and kung ano yung suggestion nyo po sa akin, at may comment kayo, okay lang po, mag-comment po kayo below. You're very welcome. Mag-usap po tayo. So today, i-share ko po ay ang 7-minute video ni Dr. Mike Hansen with regards to new drugs and for COVID-19 treatment and prevention. I always believe, by the way, my vlogs doesn't mean it's conclusive at mas pinapaboran ko ito mga to. But on a pharmaceutical perspective, ako po, just my 2 cents, I am more excited to new drugs that can be used as prophylaxis kaysa sa mga vaccines. Yun po ay sa akin. Hindi ko po sinasabing yan po ay tamang opinion, no? So, yun po ay sa perspective ko lang. So, yun po ang mas pabor sa akin. Mas gusto kong makakita ng mga new prophylaxis drugs na pwedeng gamitin at ng mga karaniwang tao, ma-prescribe ng mga doktor para po ma-prevent and ma-treat on the early stages of COVID-19, ang COVID-19, no? So, on its early stages po sa mga pasyente. With that, ito na po, i-share ko na po sa inyo ang vlog and video, published video of Dr. Mike Hansen. New drugs for COVID-19 treatment and prevention. Ito na po.
Imagine if there was a pill you could take to treat COVID before COVID causes pneumonia and low oxygen levels. Could an antiviral medication called Molnupiravir eliminate SARS-CoV-2 from an infected person's nose and throat? This oral medication, which is taken twice a day for 5 days, was initially developed for the treatment of influenza. Molnupiravir seems to also be effective against SARS-CoV-2. There's a phase 2A study that was recently done. It enrolled 202 non-hospitalized adults with signs and symptoms of COVID-19 and confirmed infection. At baseline, 42% of participants had detectable levels of SARS-CoV-2 virus when it was cultured. The study had 3 arms of the treatment group taking 200 milligrams, 400 milligrams, and 800 milligrams of Molnupiravir, respectively. And there was a control group. Participants' noses were swabbed on days 3, 5, 7, 14, and day 28. A reduction in SARS-CoV-2 was noted in all treatment groups, but was only considered to be significant in the 800 milligram group. There's a much larger phase 3 trial underway with 1,300 participants. Molnupiravir, it works by introducing copying errors when viral RNA replicates. Similar to DNA, RNA is made up of 4 different nucleosides. In RNA, there's adenine, cytosine, guanine, and uracil. Molnupiravir exists in 2 forms. In one form, it mimics cytosine, and in the other form, it mimics uracil. When SARS-CoV-2 grows in the presence of this drug, its RNA-dependent RNA polymerase, the enzyme that reads RNA, it reads cytosine as uracil and then puts the wrong nucleoside in that RNA sequence. This misreading creates a massive number of mutations in the viral genome, rendering the new RNA useless. Molnupiravir was originally developed at Emory University and was later acquired by Miami-based Ridgeback Biotherapeutics, who later partnered with Merck & Company to develop it even further. In April 2020, a whistleblower complaint by a former head of BARDA, Rick Bright, expressed concerns that similar drugs had the potential to damage DNA. Bright notes in his complaint that, quote, similar experimental drugs in this class had been shown to cause reproductive toxicity in animals, and offspring from treated animals had been born without teeth and without parts of their skulls. George Painter, who's CEO of Drug Innovation Ventures at Emory, he replied to that comment saying, quote, we haven't seen robust evidence for any sort of mutagenicity as had been seen in the past by others. In the phase 2A clinical trial, 7 participants discontinued treatment, though only 4 experienced adverse events, none of which were considered related to Molnupiravir. As of the making of this video, the trial is still blinded, so what the exact adverse events are still not known. There are also several other antiviral drugs for COVID that are in development, like upamostat or RHB-107, then there's AT-527, and then favipiravir. And what about COVID prophylactic drugs? Let's say you're exposed to someone with COVID. Is there a post-exposure prophylactic drug that you can take? In December of 2020, researchers at Georgia State University published a study in Nature Microbiology that showed that giving Molnupiravir to ferrets infected with SARS-CoV-2 prevented transmission to uninfected ferrets housed in the same cage. So this is great news for ferrets. Human trials should be coming soon. What about another treatment option for COVID-19 that must also be given early in the course of illness? Monoclonal antibodies. SARS-CoV-2 uses a spike protein to attach to the ACE2 receptor and then enter human cells. Monoclonal antibodies bind to a specific protein surface, meaning antigens. These monoclonal antibodies bind to the spike protein of the virus, preventing it from invading the human cell. When it does this, it also tags it to let the immune cells of the body know that it should destroy it. Monoclonal antibodies can be produced by exposing a mouse or a hamster to an antigen, and antibodies made are then collected. Today, antibodies can be made in the lab and are used to treat nearly 100 conditions, including cancer and autoimmune disorders. The monoclonal antibodies used to treat COVID-19 include Regeneron's clone of an antibody harvested from a person who recovered from COVID-19, and an antibody harvested from a genetically modified mouse engineered to have a human immune system. Eli Lilly's monoclonal antibody, bamlanivimab, was identified in a blood sample from a patient who recovered from COVID-19. Clinical trials showed that monoclonal antibodies can prevent deaths and hospitalizations in people with mild to moderate COVID-19 who are at risk of severe disease. A study of VIR 7831, a product made by VIR and GSK, reduced the chances of hospitalization or death by 85%. A randomized, double-blinded, placebo-controlled phase 3 study showed a cocktail of two antibodies, bamlanivimab and etesevimab, both made by Eli Lilly. They cut the risk of hospitalization and death by 87%. Monoclonal antibodies will likely provide the greatest benefit for those older than 65 and those with a suppressed immune system or a comorbid condition like obesity, heart disease, chronic kidney disease, or diabetes. They've also demonstrated safety and efficacy in their respective clinical trials, but they're not widely used in the United States. Why? Well, there's several various reasons for this. One, besides the cost to produce them, they need to be given through an IV in an infusion center. Two, the results of the clinical trials have been released and submitted to the FDA, but some have still not been published in peer-reviewed journals. Three, there was initially mixed messaging on whether monoclonal antibodies are effective. They are believed to be effective in the early phase of COVID-19, but not the late phase. Since they're directed towards the spike protein and variants have mutations in the spike protein, there's also a question on whether they're going to be effective against the new SARS-CoV-2 variants. So far, they seem to be effective against the B.1.1.7 or the UK variant. Using a combination or a cocktail of monoclonal antibodies can help ensure that at least one antibody will fight the infection. Also, they last about 3 to 4 months in the human body. Antibodies made by the body as a result of the vaccine, well, they give protection for about a year or so. Regardless, monoclonal antibodies are an effective stopgap until everyone can be vaccinated. So that's going to be all for this one. Thank you for watching, and if you haven't done so already, go ahead and click on subscribe and hit that bell notification. That way you can be notified of when my next one comes out.
So, yun. Dun po nagtapos yung video po ni Dr. Mike Hansen, which is I was so excited that he has been mentioning a lot of very known pharmaceutical companies like GSK. Nung binanggit niya yung GSK, natuwa ako because GSK is actually the company called GlaxoSmithKline, and I have so many friends, medical representative friends noon sa GSK, no, GlaxoSmithKline. It's actually a merging of two companies kaya naging GSK, Glaxo and SmithKline. And also the name of Eli Lilly, no? So, isa yun sa mga pharmaceutical companies na mga kalaban namin direkta sa mga gamot namin dahil ako naman ay galing sa Abbott po noon, Abbott Laboratories. And the reason why I got excited and thrilled with this the vlogs made by Dr. Mike Hansen is because these drugs na mga sinasabi niya are tested in the pre and post exposure to COVID as prophylaxis, as could be prophylaxis drugs against COVID, either pre or post exposure. Ibig sabihin, bago ma-expose ang pasyente or na-expose na sa COVID, at ito yung mga gamot na tuloy-tuloy na pinag-aaralan nila ngayon na mga companies at ginagamit ng mga scientifico, mga doktor, para makita po nila yung result nito ay kung ito ay mas maganda na gamitin in the very near future once FDA approval has been given to these drugs, no? Pag na-approvehan na po siya ng FDA. In fact, nasabit na nila. Yung karamihan dito ay nasabit na nila yung tawag dito is yung studies nila sa mga produktong ito na kanilang nagawa po, no, itong mga companies na to. So it's very promising, and I'm so excited. Mas excited nga ako dito sa mga prophylaxis drugs, medicines na pwedeng i-take po ng mga tao kaysa sa mga vaccines. You know why? Because this could be cheaper. This will take a lot of fear among all of us kasi pwede na tayo uminom ng prophylaxis. Pag sinabi kasi prophylaxis, ito po ay parang prevention, no? Para hindi ka, kung tamaan ka man, ikaw ay safe na, no? Na meron kang iniinom na prophylaxis, pang-prevent. Yun ang ibig sabihin ng prophylaxis, eh. Prophylaxis, no? Pang-prevent. So, and at the same time, it can be available to a lot of people, no? So, hindi katulad po ang vaccine, katulad ngayon. Well, ang ginagawa po ng government is sila nagpo-procure at maaaring mabigay ito sa inyo libre. Pero kung sa mga may kaya na nagmamadali, no, bumibili po sila ng kanilang mga vaccine, which is much more expensive, no? Kaysa katulad nito mga prophylaxis drug. So, I believe in a year or two, marami na to kasi tuloy-tuloy na maraming company ang gumagawa ng mga prophylaxis drug for pre and post exposure into COVID, no? So, with that, again, sa mga doctors out there, please comment below if you're a doctor, and kung maganda po ba yung video na shinare ko po sa inyo coming from Dr. Mike Hansen, no? And very soon I'll be also sharing videos coming from Dr. Roger Schultz. Mahahaba lang kasi mga videos ni Dr. Roger Schultz, no? Tsaka mas malalim yung mga medical terminologies. So with that, again, I hope you like the video, this vlog. But please, pati sa mga doktor dyan, please suporta po para tuloy-tuloy po akong makapag-share ng video para sa inyo lahat ng mga katulad nito. Please subscribe to my channel, subscribe, at if you like it, please do like and hit that notification bell button para naman po tuloy-tuloy rin na ma-notify kayo ng mga bago ko pong videos. I believe I will be focusing more on this vlogs or published vlogs of people like Dr. Mike Hansen, Dr. Roger Schultz, because I'm getting more comfortable in sharing to you medical vlogs po, no? So, or videos, either published videos or published medical articles. With that, thank you very much. As I always say, peace, God bless, and love one another, more so your families. Thank you. Bye-bye for now.